I'm Jenny Metzler. I'm the Executive Director of Albuquerque Healthcare for the Homeless. Albuquerque Healthcare for the Homeless is the only organization in central New Mexico that provides comprehensive health and social services exclusively to the population without homes. We've been doing that since 1985. Our mission is really to end homelessness. It's not just to provide medical care or other health services to people without homes. And that's really because our understanding of homelessness is that one of the main structural causes that lands people on the streets is lack of access to health care. We know it can really bankrupt anyone. So that's been the lens that we provide care to be able to end homelessness is our ultimate mission. Our dental program has been around almost as long as we have, for about 30 years now, and we're part of a national movement. We always say healthcare for the homeless is more than a model, it's actually a movement to address homelessness and to get care to people. And we can't do that unless we provide all the care that they need. There are about 300 federally funded healthcare for the homeless projects around the country now, and there are some required services. Oral health has never been a required service. It's something additional we can provide. And because it's not required, we don't prioritize our federal funding with that, so we look to other community resources to be able to sustain that program. We really feel like it's a need and we have to do it, whether it's required or not. A grant from Albuquerque Involved will help us with a piece of that leveraging of funds to be able to provide comprehensive dental care. We do dentures. You can imagine if you don't have teeth and you're on the streets, you can't eat and take care of yourself. You're in pain. You could have other infections and have systemic issues with your health. You can't just go talk to a landlord when you don't have teeth and you're not feeling comfortable or healthy. Self-esteem is bad. There are just a lot of health and other implications about how not having teeth can keep you from moving off the streets and into housing. So we provide dentures, and I think of it as sort of the linchpin or the caulking between the big services and that one little thing that can get someone to the next really highly impactful service that will get them off the streets.
My name is Charlena Waters. I'm the Dental Director at Albuquerque Healthcare for the Homeless. So this work is important to me because I believe that dental care is important and everybody has to have it. Without it, people live in pain, people live with infections, people lose their teeth, they can't eat, they can't speak well. I, as the dental director, mainly treat our patients that come through the door, help them take care of the comprehensive oral health needs. So we do exams, x-rays, we provide cleanings, fillings. We also, make dentures and partial dentures for people who are missing teeth. We offer same-day appointments and scheduled appointments. We provide walk-in visits for people with toothaches every day, and that's something that we see quite often with our population. A lot of people have other priorities, looking for shelter, looking for food, and always coming to the dental clinic isn't top on their list. So we try to have open access available to them when they're ready to come in and see us.
I am a patient of healthcare for the homeless into the dental clinic. I came in one day and I had no teeth. I had been at a shelter. I stayed at a shelter for almost a year, and I went down to healthcare for the homeless, and somebody mentioned to me they have a dental clinic. I walked in, and from that day forward, it has changed my life. It has done so much for me. I am just so grateful to from the top executive to the techs, to everything that everybody did for me. They did it for me, and that made me special. I want to thank everybody for it.